Dear friends, welcome to Know Thyself YouTube Channel. Good morning. Hope you are all staying safe and keeping well. I sincerely thank all of you who have subscribed to this channel and follow the channel. If you find the contents of the videos uploaded in this channel useful, please subscribe to this channel and click the notification or the bell icon so that you can be notified when a video is uploaded. Kindly share the videos with others or on the internet. In the last episode of Know Your Mind segment, we considered the second anxiety disorder, namely phobia, in detail. In this episode, we explore the third anxiety disorder, namely obsessive-compulsive disorder, in detail. Obsessive-compulsive disorder, also known as OCD, is an anxiety disorder that is common, chronic, and long-lasting. It involves a pattern of uncontrollable, unwanted, upsetting, and recurring thoughts and fears called obsessions, and which urge you to repeat certain behaviors called compulsions over and over again. Though you may try to ignore your obsessive thoughts and fears and stop your compulsive repetitive behaviors, you find that your obsessions only increase your distress and anxiety, and your compulsions drive you to perform the repeated behaviors so as to ease your stress, distress, and anxiety. Thus, despite your efforts to ignore your bothersome thoughts and urges, they keep coming back to you, and instead of getting rid of your compulsive behaviors, you keep repeating them to ease the stress resulting thoughts and fears, leading to the ritualistic behavior, namely the vicious cycle of obsessive-compulsive disorder. Both the obsessions and compulsions associated with OCD are unreasonable and irrational. And so, reasoning neither helps to control obsessive thoughts and fears, nor to regulate the compulsive behavior you repeatedly perform to ease your thoughts and fears. These obsessions and compulsions often interfere with your daily activities and cause you significant distress. Let us explain OCD with an example. You have an obsessive or excessive fear of getting infected by germs and viruses. And to ease this obsessive fear of infection, you may compulsively wash your hands continuously. Thus, your obsessive fear of infection and compulsive washing of hands to get rid of your fear of infection can become a ritualistic behavior and a vicious cycle. Since OCD includes both obsessive thoughts and fears and compulsive behaviors, it has both obsession symptoms and compulsion symptoms. Let us briefly talk about both of them. Obsession symptoms. Obsessions are repeated thoughts, urges, or mental images that cause anxiety. Common obsession symptoms include strong and fixated fears about germs, viruses, or contamination by dirt, getting caught up in doubts, having difficulty tolerating uncertainty, having aggressive or horrific thoughts about losing control or harming yourself and others, having unwanted, forbidden, or taboo thoughts involving sex or religion, and needing things to be symmetrical or in perfect order. Some examples of obsession symptoms include fear that you will be infected by viruses or contaminated by dirt by touching objects others have touched, repeated doubts if you have locked the door or turned off the stove, intense stress when things are not in order, fear that you would shout obscenities or act inappropriately in public, getting caught up in unpleasant and awful sexual images, spending long period of time touching things or counting money, troubling thoughts about your religious beliefs, and avoiding shaking hands. Compulsion symptoms. Compulsions are repeated behaviors a person with OCD is urged to do in response to an obsessive thought or fear. Some compulsion symptoms include compulsive washing or cleaning, checking, counting, orderliness, following a strict routine, and demanding reassurance. Some examples of compulsion symptoms include washing hands until the skin becomes raw, checking doors repeatedly to make sure that they are locked, checking the stove repeatedly to make sure if it is off, counting in a certain pattern, silently repeating a prayer, word, or phrase, fixated arranging of your room in a certain way, putting on clothes in the same order each day, placing spice bottles in the alphabetical order in your kitchen, and getting upset if the order is disrupted. Some people with OCD suffer from tic disorder. There are two types of tic disorder. First, motor tic disorder, which consists in sudden, brief, and repetitive movement of body parts such as eye blinking or other eye movements, face frowning, shoulder shrugging, or head jerking. Second, vocal tic disorder, which consists in repeating sounds vocally, such as repetitive throat clearing, sniffing, grunting, murmuring, or grumbling. Like other anxiety disorders, genetics and family history, brain structure and functioning, and childhood traumatic experiences are some of the factors that contribute to the emergence and development of OCD in people. Symptoms of OCD may come and go, ease or worsen over time. Stressful events may trigger OCD episodes or make them worse. People with OCD may try to help themselves by avoiding situations that trigger obsessions and compulsions or use alcohol or drugs to calm themselves. Most adults with OCD recognize that their fears and ritualistic behavior or getting caught up in a vicious cycle does not make sense. However, some adults and most children do not realize that their behaviors are out of the ordinary. Getting caught up in the vicious cycle between obsessions and compulsions can disrupt your normal and everyday life by interfering with your daily routine, social interactions, your work at school or at office. Besides making you feel ashamed and embarrassed about the condition. Giving timely treatment, which includes medication, therapy, or both, can help greatly reduce the time you spend in your anxiety-causing thought patterns and getting lost in your compulsive behaviors. In the next episode, we will begin our analysis of behavioral disorders. Thank you for watching this video. Stay blessed until we see you again with another video.